But first, a scramble is happening this weekend to get doses of AstraZeneca into people's arms in Ontario. 45,000 of those shots expire on Monday. Manitoba also has a few thousand doses set to expire. It's not clear how many more are about to hit their best before dates in the other provinces. So what happens if thousands of doses go to waste? Well, Anita Anand is the minister responsible for vaccine procurement. Minister, thank you very much for joining the program this afternoon. Ontario has about 45,000 AstraZeneca doses set to expire on Monday. Manitoba, another 3,000 doses that are set to expire in the coming days. What does this mean broadly when you look at the prospect that we're getting more of this vaccine into the country?
Well, let me begin by saying that it causes me great concern when I hear of the possibility that doses may be going to waste. We have worked very hard as a government to bring doses into this country. We have received complaints that there isn't enough supply. And so the thought that Canadians would not be vaccinated because doses are going to waste causes me great concern. And I know my colleague, Minister Hajdu, has written to the provinces to emphasize the availability of federal assistance in order to ensure that this does not occur.
Now, the Ontario government has said that it believes part of the reason this is now occurring is because of the shifting guidance around can AstraZeneca be used and then by whom. They've had to go out to the places that it was and bring it back into a central location before distributing it out. That has been the explanation from Ontario. Do you accept that as a reason for the situation we find ourselves in now?
Well, listen, my role as the Minister of Public Services and Procurement is to bring in as many doses as possible to the country for the benefit of the health and safety of Canadians, and that's exactly what we are doing. We've distributed 26.2 million doses in total thus far, allowing 60% of Canadians to have at least one dose of vaccine. Again, the idea that doses that we are bringing into the country for the benefit of Canadians are going to waste is very unfortunate, and we need to be donating doses that we're not using. So again, let's make sure doses don't go to waste. That's the most important thing. People around the world need vaccines, and we need to be responsible about our use of vaccines.
Okay, so a couple of things, Minister, to pick up on there. First of all is around AstraZeneca, more of it expected to come into the country. Lots of Pfizer now with a more stable timeline certainly coming into the country. Does it give you a sense that those who have had a first dose, once they have had a second dose, is it time perhaps to stop procuring that particular vaccine?
Well, we are having a conversation amongst my federal government colleagues about the potential to donate doses. Of course, we do believe that, and until everyone has had a vaccine, that we're not really able to combat this virus. And so we do feel a great responsibility to the developing world as well. That's why we are taking a leadership role in the COVAX facility from a governance perspective. That's why we've donated over $400 million to COVAX. And so we will continue to have that conversation across government and hopefully have some more news on that in the near future.
Okay, and I'm going to pick up on that because when you say the near future, you know, we had Taiwan's foreign minister on the program earlier this week, and he said he would quite readily accept any donations from Canada. No question about what is happening in India and the need for vaccines there, and there are so many other countries like that. Do you have when you say in the near future, are we talking about the next couple of weeks that you anticipate being able to make an announcement about donating vaccines to other nations?
Well, David, my responsibility as the Minister of Procurement is to bring doses into this country for Canadians. We have distributed 26 million vaccines to Canadians thus far, and 60% of Canadians have had at least one dose. So my focus is to continue to bring vaccines into the country. And on the topic of future donations, et cetera, that is a whole of government conversation and is being led, of course, by Minister Hajdu and Minister Gould, who have particular areas in their portfolios in this regard.
What can you tell us about this sort of post-August 1st, which seems like a long way away in some ways, but of course actually is not? We see deliveries up to that point. Is there the anticipation that Canada would still be buying in such large volumes at that point?
Well, again, this is a very volatile market. We have brought in 26 million doses, as I said, but by the same token, suppliers are continuing to ramp up. We have one supplier, Pfizer, that is going to be delivering 2.5 million doses per week over 5 weeks in June, and then 9 million doses in July. We have another supplier, Moderna, that provides us with delivery schedules much closer to the delivery dates that we are going to be receiving those doses by, and we expect millions of doses from Moderna. But the bottom line is we will have enough doses for all Canadians to be fully vaccinated before the end of the summer, and we will support the provinces in their inoculation plans by bringing in millions of doses, and that's continuing to be our project and objective.
Minister, I want to ask you about the Auditor General's report from earlier this week, just in the context of nobody wants to think about the next pandemic. Obviously, we want to get through this one. But of course, planners do have to think about what might come next. And the Auditor General made clear that the government had failed to properly prepare with a national emergency stockpile of PPE. And we saw the results of that early on. Where are we at in terms of the PPE that has been purchased? Presumably there's enough of it. When does it expire, and what plans are there to ensure that it is replaced when it does expire?
So just to be clear, David, the Auditor General's report in terms of my department of PSPC was fairly positive. Indeed, she said that in a very volatile and competitive global environment, PSPC worked very hard and effectively to procure PPE. And in fact, we did procure 2.7 billion items of PPE.
But Minister, part of the reason she said that was because you had to do that, because the stockpile was basically gone or expired. What reassurance do we have that the stockpile is big enough now, and when it expires, it'll be replaced?
Well, the stockpile, of course, has been continually supplemented by the ongoing deliveries of those 2.7 billion items of product that we're bringing in. In fact, my goal at the beginning of the crisis was to put in place long-term contracts for the delivery of PPE in case of a second wave, in case of a third wave. And so we are very well stocked in terms of PPE at the current time. And I know that the Public Health Agency of Canada is examining expiry dates to ensure that those are adhered to.
All right. Minister Anand, thank you so much for your time. Really appreciate it.
Thanks, David. Have a great weekend.
You too.
Hi, I'm Vashi Kapellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.